My name is Giuseppe Vecca. I come from Italy. For many years I was unaware what a sleep apnea was. My biggest problem was sleeping at night.
I'm Dr. Rajendra Ramprasad. I work at St. John's Riverside Hospital. At the hospital, I am the medical director of the intensive care unit. I'm the medical director of the sleep center. I work in the hyperbaric center. Sleep apnea is a condition that basically means the patient is having some sort of breathing insufficiency at night. The way we diagnose it is by doing a sleep study. Basically what we do is we look for how many times per hour the patient has a respiratory disturbance, and if it's more than 5 times per hour, it meets the diagnosis of sleep apnea.
The decision that I made to go to the doctor for the sleep apnea was driving it 500 feet away from my business place at the red light. I closed my eyes, and when I wake up, I find the car in the grass on the side, and I panicked so much that I called my wife and said, I gotta call the doctor and see if there has to be something they can do for me.
There's actually 81 different sleep disorders. So sleep apnea is usually the one that we try to look for because it's one of the few that causes medical morbidity, meaning that if you have sleep apnea and it's not diagnosed, it can lead to hypertension, to diabetes, to cholesterol issues, earlier heart attack, earlier stroke, a lot of chronic medical illnesses. What the patients do is they get contacted by our sleep center, and they come in and they have their own individual room. The test is completely non-invasive, which means that there's no pain, there's no discomfort, there's no invasive monitoring.
I wake up in the morning a completely different person. That was the first day, the first night, and I slept a full 7 hours, which I never did in my life, to sleep all of those hours. I drove myself. I saw things in the road that I never saw before that day. The life, I had so much energy. I went to work, I was singing and dancing all day long.
One of the most rewarding things about working here at St. John's is the close personal nature I think the patients have with us here at the sleep center.
The staff at St. John's Hospital, they were fantastic. They were so cooperative. They explained to me step by step.